I'm glad to be back. I appreciate you letting me come in often during recesses and other times, and you know, whether you agree or disagree, sometimes, and I know you do a little of both, I really appreciate the way y'all allowed me to come in and talk to you this way.
Well, we're happy to have you here. I want to start, Senator, by getting your views on the recent town hall meetings that have been going on around the country. I know you had one this morning. I think you're going to have another one this evening.
Yes, sir.
Some of them have gotten pretty contentious. We had one here in Memphis on Saturday with Congressman Steve Cohen. And there have been varying views about those town hall meetings. Newt Gingrich, for example, said this is just an example of people venting, and we should let them do that. Dick Durbin said it was an orchestrated effort, primarily by opponents, conservatives. I'd like to get your view on the recent town hall meetings, and then talk a little bit about the ones that you had this morning.
You know, I'm going to be in 28 counties during recess. I think we're doing 18 town hall meetings, and then we're doing other kinds of things, like, for instance, today in Shelby County, I spoke at the Rotary Club, and there were numbers of questions there. The media was there. But we did one this morning in Covington, and we're going to do one this afternoon in Oakland. I'm also going to be, I would do even more than 28 counties, except that I'm going to be in Afghanistan and Pakistan also. But look, number one, today we had 280 people in this small chamber room in Covington, and I just thought it was outstanding. You know, people are very conscious of what's happening in Washington now. There were people in the room today that, you know, certainly many of them agreed with my point of view, many of them disagreed, and there were people in the middle. But everybody today was very respectful. I hope that they felt I returned that. I mean, we started off the meeting saying that, you know, I appreciated them being polite, and that I was going to return the favor by certainly listening to their questions intently and trying to answer them to the best of my ability. So the crowd was, I thought, incredible. I think it's very much the way Tennesseans generally are. I mean, it's a very patriotic, you know, volunteer state that cares greatly about the issues, especially now. I do think that, again, I think it's a great thing that so many people are coming out. I think, though, when it gets to a point where a meeting is disruptive and you cannot hear other people's point of view, whether it's the main speaker who's there or other people in the audience, I think you can begin to tear down what's great about the public process. I mean, the fact is that I know a lot of people aren't having town hall meetings this week, right, because of what they saw take place in other places. We're doing as many as we can possibly do, and I enjoy the meetings. I enjoy even hearing people when their point of view is different. Like I said, so far it's worked well. We'll see how it goes this afternoon. I have a feeling they're all going to be very good. And I know there were people there, Otis, this morning, for instance, when we showed up today at the Rotary Club, many of the people who were there this morning, the placards, were actually at the other meeting, and they, you know, were there to ask questions that maybe challenge my point of view. Again, I appreciate them being there, and, you know, the fact that no doubt that was organized in some way, I don't find that to be offensive. I really don't. But again, if it gets to a point where you're disrupting the ability of people to talk civilly with each other, I think that tears down the public process, and do not think that's a good thing. I have a sense, we'll see, I have a sense that when we go across the state, it'll be mostly very civil.
But there have been some instances where the conversation has broken down. I mean, we, for example, Senator Alden Specter.
I saw that on tape.
Right. I mean, and that one almost got out of hand to some degree. I think he sort of lost his temper maybe a little bit there. Are you concerned that, do you believe that it's being orchestrated in any way by any group?
Look, I was asked the question, Chris Matthews asked me the same question on MSNBC Live, like we are right now. I don't know of anybody who's orchestrating events. I mean, again, there was a group today that cares a great deal about health care, and the fact that they are, as a group, care about that issue and are there, do I feel like that's orchestrated? Well, I mean, they were very polite. They asked questions that were intelligent, and I was glad to answer them. So I think it would be, based on what I know, okay, I think it would be a gross misstatement to say that around the country, you know, this is being organized. What I would say, on the other hand, is that, look, I think people who are very concerned about a government takeover of health care probably have a stronger emotion about that than maybe on the other side. I think there's just a lot of currents. If you look at, you know, what's happened in the automotive area, you look at what's happened in the financial area, I think people are becoming increasingly very concerned about what government role is going to take place in their life, and I think that has created some concern. But again, so far so good. We're going to be throughout the state all month, and we'll regroup with you when it's over and tell you how it went.
Okay. Well, you mentioned today at the Rotary Club that you did have some concerns about the legislation, especially what's going on in the House.
Right.
Primarily because of what you feel is the astronomical costs that are associated with it. Would you elaborate a little bit more on that for our audience?
First of all, you know, I was Commissioner of Finance for the state, and I came in a year after TennCare had been put in place, and I spent in that role, which at that time the Chief Commissioner of Finance was the Chief Operating Officer of the state. I spent 80% of my time on health care issues, and so from that time on, I have felt that our country needed health care reform. We've got 800,000 Tennesseans today that don't have appropriate health insurance. If you look at the 46 to 48 million people that don't have health insurance, I will say, and you take a pie chart, there are lots of different reasons as to why people don't have health insurance. I mean, about 11 million of those people actually are qualified for existing government programs and are not enrolled in Medicaid or S-CHIP. You've got there are about 10 million of those people that are immigrants, that are not U.S. citizens, some of which are legal, some of which are illegal. Well, that's a different situation. You've got a number of people that make over $75,000 a year that choose not to buy health insurance. You've got some young folks that think they're bulletproof and just, don't want to allocate the resources. And then you've got a large group of people that just have difficulty finding affordable health insurance or being in the position to do it. There may be pre-existing conditions. So you have to look at the wide gamut to understand there's not really a monolithic solution, okay? And I want to see health care reform take place. It's my hope that after this recess that there'll be a more centrist view about how we go about doing it. And I think the first concept, as I said today at Rotary, is let's don't do harm. I mean, those people that today that have health insurance that they're satisfied with, let's don't harm that. Secondly, let's don't create massive problems for a program like Medicare. I mean, I'm going to probably be saying this so many times you're going to be tired of hearing it, but Medicare is insolvent in the year 2017. It keeps moving towards us, not away from us, as far as when that year is. And, while I don't really want to address the House bill so much, because I don't think it's actually going to be one that's seriously debated, okay, I just don't. I think it probably goes in the circular file when we get back, okay. I don't think the Health Committee bill that came out of the Senate Health Committee is going anywhere. I think it goes in the circular file, but I think the Senate Finance Committee is a place that people are saying, hey, there may be something that comes out of that could possibly be pragmatic. However, one of the foundations that they're building off of is taking $410 billion out of Medicare, which is insolvent, and using that $410 billion to leverage a new entitlement. And I know that each of you have watched us pull our hair out in Washington each year as we deal with something called SGR. You may have heard it called the Doc Fix, but I think you know that in Washington every year, year and a half, 2 years, we kick the can down the road towards putting money into Medicare that causes doctors and nurses to just get paid the same amount they were paid the year before. This last year, if we hadn't done it, physicians would have taken a 21% decrease in payments. Nurses, 21%. So they're not even dealing with that issue. And I said today at Rotary, for a physician, your doctor, to make the same amount treating you in Medicare in a decade as he does today, just even, not more, no escalator, costs $285 billion. So for a principal foundation, a building block for this new health care plan to be taking $410 billion out of Medicare, not dealing with the provider payments, to me is ludicrous. Okay, I mean, it's like a non-starter. To me, that doesn't make any. Secondly, to change the formula for states like Tennessee, where on Medicaid, where you're taking it from 100% of poverty to 133%, but then adding in a whole new category of folks. Right now, most people in Medicaid are women who are pregnant or young children. I mean, that's what Medicaid is for. And to change that to 133% and everybody being included is about a $450 million per year hit to the state. Governor Bradison, as you know, is on the other side of the aisle, a knowledgeable guy in health care. I mean, you know, somebody when he speaks, I think we all listen. He calls it, these are his words, y'all read them in the New York Times, and he's been quoted over and over as the mother of unfunded mandates. In other words, the federal government saying we're going to solve our federal health issue by creating this unfunded mandate. So to me, that's a non-starter, okay? And then the third issue that's a non-starter to me is having a government plan that, quote, competes with the private sector. Let me refer at this moment to Medicare Part D. Okay, Medicare Part D, when it was created, wasn't funded, and I would not have supported it for that reason. It created, the day it was put in place, an $8 trillion unfunded liability. However, and there's a donut hole issue, and y'all have heard seniors talk about that. Some of you may have had issues with that. The one thing that worked, though, in Medicare Part D was seniors today have almost too many choices. I mean, you know, what we hear from seniors is, gosh, there's 20 or 30 or 40 plans that are competing for my business, okay? So the notion, and by the way, Medicare Part D has come in far less in cost than anybody thought it would be, but it was created, it was actually a private market that was created around this pharmaceutical benefit. If we just create proper exchanges where individuals, small businesses are able to buy like that on an exchange at competitive rates to large business, there's no need for first of all, there's no need for a public plan. I mean, it's like saying we need to own, instead of 60% of General Motors, we need to own 100% of General Motors to keep Toyota honest. I mean, it's not a sensible idea, in my opinion. The fact that the president argues for MedPAC, a group of unelected people, to make decisions about Medicare benefits, what he's really saying is that when a plan gets into the public arena, it only goes one way, okay? That we as elected officials only want to make our constituents happy. We don't want to take things away, so we keep adding benefits. And so the only way to get Medicare under control, this is him, is have MedPAC make some of these tough decisions. That, to me, argues right there against a public plan. So to me, a public plan is a non-starter. I think there's numbers of moderate Democrats that have huge issues with that, too, I might add. So what is a good idea, okay? Well, first of all, there are some insurance reforms that need to take place. I mean, some of the folks had placards. I'm looking, I apologize. What is your name again? Lindsay. You know, some of the folks today had placards that they were carrying talking about the need for insurance reform. I agree with them, okay? And the fact is that, you know, if you have a pre-existing condition, you know, it's hard to buy health insurance. And so I think there need to be reforms where we create enough of the population being insured, and I'm going to get to a way to do that, that the insurance companies have to take all takers as long as you enroll during an enrollment period. You don't wait until you're ill to actually buy the health insurance, okay? We had some of those problems with TennCare. People would wait until something happened and then they would enroll. Well, that's obviously not appropriate either. One of the things we could do to go way down the road to giving people access to private, affordable, quality insurance is to do something with the employer exclusion. Let me just give you one number. Right now, if the commercial appeal provides your health insurance to you, and they do, I'm sure, it's tax-free to you. You don't pay tax on it. If you work for a company that doesn't provide it, you don't have that benefit. As a matter of fact, if you are an individual and you try to go out and buy that health insurance, you have to buy it with after-tax dollars. So there's some tax code things we could do to make it deductible. Something else we could look at is what's called capping the employer exclusion. Okay? Let me give you an egregious example, and I'm not trying to pick on them. It's just that, you know, major publications have written about it. Goldman Sachs provides its executives a $41,000 a year health plan, and they get that tax-free. I'd like to see what all's in that health plan, but let's say that you said, okay, we believe that $17,000 a year is enough of a tax-free benefit for any family in America. Okay, and you said that we were going to tax anything above $17,000. That generates $350 billion over a 10-year period. And there's all kind of things that you could do with vouchers to actually time refundable tax credits to people so that they, on a 1/12 per month basis, could actually purchase health care. There have been other ideas about resorting to a tax credit system. Both of those that I just threw out can be done in a budget-neutral way and add tens of millions of people to the rolls and really move way down the road towards solving this problem. And I think there is enough support that we can, I think there's a lot of bipartisan support for solutions like that that don't totally change the world, that don't, do harm to people who already have health insurance, that don't force a government plan or potentially a bureaucrat, if you will, to be involved in your health delivery. And I think those are the kind of things, Otis, that once this recess is over, I'm hopeful that we're going to come back and we're going to focus on something that really moves the country ahead and doesn't increase debt. Now, I just want to recite one more time the debt issue. We certainly, this is not a new phenomenon, okay, and I want to make sure nobody in the room believes that I'm saying this just happened 6 months ago. Our country has a huge amount of indebtedness. And if you actually looked at the real indebtedness we had, if you really had a consolidated balance sheet and you took on the liabilities of Freddie and Fannie and the unfunded liabilities of Social Security and Medicare, it would scare the living daylights out of you. But the fact is that we are going to, over the next 5 years, double the amount of debt that this country has had since inception. Double it. And then the 5 years after that, based on the 10-year budget that was laid out by the administration, we're going to triple it. Okay? So you have countries, and this is not rhetoric, you have countries like China that are our biggest lenders. And we buy their products, they loan us the money to do it, right? It's a symbiotic relationship that a lot of people are uncomfortable with, but exists. They're very concerned about our long-term liabilities. And one of the things that we should do first, let's make Medicare solvent. Let's make Social Security solvent. So even while we're going through this short-term, hopefully short-term issue of this recession, we're at least addressing our long-term liabilities.
Okay. I want to get some other questions in here, but isn't it a fact, though, that if we do nothing, healthcare costs will only continue to rise?
Yeah, I think that's right. I think we've got a system right now, Otis, that providers are paid to render more services instead of keeping people healthy. And I think there's a lot of work that needs to be done at HHS. The federal government pays for about half the health care in this country, okay? And it's on a fee-for-service basis. So if you're a physician and, you're a human being, let's face it, you have a family, you realize the way that you're going to make money, it's just like a reporter. If you give them more budget lines, more lines in the budget, and that's how they make their living, they're going to write more stories. The fact is that, and I know they'd all like to have more, you don't give them enough, but the fact, I'm talking about as far as budget, I'm not talking about pay. The fact is that our fee-for-service system causes providers to order more and more tests and do more and more things because it generates income. And we do need to reform the system so that it's based on outcomes, okay? But now, let me just, do you really want 100 senators and 435 House members sitting down in September and revamping all of that at one time? I mean, I got to be honest, I have respect for my colleagues. That would scare the living daylights out of me. So it seems to me that what we've got to do is that HHS, which is one of the reasons I was hoping Bradison would be our HHS person, okay? But we've got to work through, we've got to do pilots, we've got to see what works, and then we've got to spread it out to the broader population once we see things work. Those are the kind of things that I talked to the President about when he invited me in, which I appreciate. But that takes tough work. It takes an entire term or 2 terms of people working through those issues, not just a political victory in the fall of '09, but a real commitment towards changing delivery a step at a time.
Would you be in favor of a co-op type arrangement?
Well, it depends. I mean, you know, it's an interesting, you know, when people threw it out, Kent Conrad, my good friend from North Dakota, who you know, I have a lot of respect for, when he first threw it out, a lot of people were saying, look, Blue Cross began as a co-op. As long as it has no government support, as long as the government isn't backing it, like with Freddie and Fannie, okay, it seems harmless. Now, what's happened is, in order to sort of reach accommodation for people who want to see a public plan, Chuck Schumer stepped in, and now they're talking about funding it with $10 billion on the front end, and then there'll be government guarantees. So I think it depends on what a co-op is. If a co-op has no public support whatsoever, none, be no different than Mike starting a nonprofit here in Memphis and having at it. So it depends on the characteristics. But if a co-op is just a ruse, if you will, for a government option, to me it's exactly the wrong direction.
So is it clear then that you are opposed to any government involvement in funding or running health care?
No funding. I mean, I just mentioned, I think we ought to change the tax code and make it fair, and in that regard, and there are hundreds of billions of dollars that could be put to use, and no, I'm very much for causing the tax code to treat health care in an appropriate way, and actually assisting people who can't afford it to buy private health insurance. What I don't want to see happen, and I'm adamantly opposed to, is the government being involved in the actual delivery system itself or the creation of a government option.
Other questions?
Well, you set a good example for us out there on the National Mall, running up and down the mall several laps every morning, I'm sure. But,
riding a bike now, but
you're on the bike now. Okay. But so what sorts of lifestyle changes can the federal government take the lead on while we're talking about health care?
You know, we have this guy, the CEO of Safeway comes in a lot and talks to all of us, and it's remarkable what Safeway has done to actually help cause the quality of life of their employees to be better, but also drop health care costs. A lot of it's been through education and about eating and exercising and all of those kind of things. For what it's worth, it is a lot easier to do that when you're CEO of a company, okay, than it is if you're involved in the public arena. And so I think sometimes we exaggerate, okay, what government can do in that regard, okay? I think we exaggerate it slightly. On the other hand, while I don't believe that you know, I think we ought to have health reforms where, again, if we get the bulk of our society in a position to own health insurance, that you should not be denied for pre-existing conditions, okay? I think that reform should take place. On the other hand, I think that an insurer ought to be able to penalize you for lifestyle choices that you make yourselves that are detrimental to your health. Now, that's a non-starter on the other side of the aisle right now, okay? But look, if I chose, which I don't, and I know we're streaming right now, but if I chose to smoke, you know, 4 packs of unfiltered Marlboros a day, and Otis didn't, which I know he doesn't, you know, I don't know if we should be paying the same health insurance tab if we're the same age and all of that. So,
Which we are.
Which we are, that's right. So.
Let me ask you another question about that has gotten mixed up in the debate over health care, Senator, and it has to do with the discussion about euthanasia.
Right.
Are you prepared to tell our audience here today that any discussions about the bill, especially the one that's in the House, will pretty much mandate euthanasia, and will you set the record straight on that issue?
Well, first of all, again, we're not going to. It's my belief that we're never going to debate the House bill. Okay, I think it's going.
But we are debating the overall issue, and that has gotten wrapped up, including some people on Capitol Hill have said that, which is really not in the bill as I read it.
Okay, so because we're not debating the bill, okay, and I can't tell you that I've read 1,000-word pages of the bill because I know it's going in the trash can. It's irrelevant. However, I have read a portion of the bill that you're talking about, and read other portions of the bill that allude to counseling. Okay, and I think that the issue, in fairness, has been overstated. But I want to just say two things, though, that cause people to be fearful. First of all, mandating, and I'm not sure exactly what the language was, that people had to have end-of-life counseling.
Well, it provided the option, and it provided for Medicare to cover this optional consultation by doctors to people not only about end of life, but also life-sustaining treatments. It was the same thing.
Living wills. I think what would have been a good thing there, and I actually talked with somebody at the White House about that issue who had been very concerned about that language being in the bill. And let me just stop for a second and say that much of the discussion about this bill, we need to remember, is not about this bill. There's lots of different bills. And in fairness, the administration, to their discredit, has shown no adult supervision in this process. Okay, usually when you're talking about major health care reform, the administration would at least say, these are the kinds of things that we'd like to see happen, and they work far more closely. The same thing happened with cap and trade. This Waxman-Markley bill, my gosh. If you didn't make money off that bill, you didn't have a good government relations person at the table. It's out of control. And so, to their discredit, they have not led the debate, which this is a big enough issue, 16% of our GDP. The administration has a role to play in this, okay? But back to this issue, they let it happen. What could have happened would have been to say that when you are 45 or 50, that we'd like to see counseling on end-of-life issues take place. When it's written the way that it is, it does lead people to wonder if you're 80 years old and is that when you're going to have end-of-life? That's probably not a good idea, okay, to have something like that written. The other piece is, though, remember, the President has constantly talked about giving MedPAC, an unelected group, the authority to unilaterally make changes in Medicare. Well, that gives people concern that unelected people may make decisions about their health care, okay, and rightfully so, has created a lot of alarm. So look, has it been overstated? Yes. Okay? Right. Based on what I know, has it been overstated? Have people, though, based on just if you look at just the bent over the last 6 months of everything that the government has gotten involved in, has it created a sincere concern among people? Absolutely. And again, I think what we've got to do in this country is let's preserve. We have the best health care. We have the best health care when it's available to you that exists in the world, right? If you have a cancer diagnosis in Britain versus a cancer diagnosis here, you're likely your outcome is going to be much better in this country, okay? So let's figure out a way to do no harm there, but create additional access to people, and obviously try to create a mechanism like praying for outcomes somehow. We got to figure that out. You can't just mandate that in a bill. Figuring out a way to to pay physicians and providers for outcomes and not for the amount of services they deliver.
Yeah, I've heard you use that. Read an article where you were quoted saying that Democrats needed some adult supervision when it comes to health care, and you just mentioned it now. Well, what do you mean by that? I mean, it seems to be a bit of a put down, or what are you trying to say that they need adult supervision, that they don't know what they're doing?
I'm saying that the administration on this issue and on cap and trade, and I think actually people on both sides of the aisle that are opinion leaders around this country that write in publications that we all read on both sides of the aisle have said the same thing. I mean, this debate, the president lost control of this debate. Look, I'm in a legislative body. There are 100 of us. You know, it's like a herd, okay? It's not a put down at all. The administration has at its fingertips resources that are absolutely incredible. I mean, you had an HHS secretary with their whole staff. You have hordes of people who work with you. Peter Orzag's one of the brightest guys up there. He's, you know, the budget officer. Nancy Ann DePaul is from our state, worked with Governor Bredesen, one of the most, you know, respected people in the country. But what they haven't done is typically they'll come meet. I mean,
but those are all adults, though, right?
Yeah, but they have not shown adult supervision over the legislative process. That's what I'm putting myself down. I'm not putting them down. I'm saying that a herd of folks, you know, you can't give committees no guidelines and just say, come up with a hell, you know, hey, you guys come up, and by the way, you guys come up, and then you guys come up. I mean, you can't do health care that way. You've got to have some guiding principles. And as an administration, you've got to shepherd it through. So I'm putting those of us in the legislative body down when I say that the administration is not given adult supervision.
But it just seems to me, Senator, though, that...
Does that make sense?
That makes sense.
Okay.
It feels, whether you agree with what's being debated in Washington about health care right now or not, it seems to me that the opposition has taken on the tact of being as vociferous as possible, being as loud as possible, being as confrontational as possible as a way to derail the discussion here. Is that a fair statement or not?
Absolutely not. You've heard me speak today at the Rotary Club.
Well, I'm not talking about you personally. I'm talking about. I'm talking about.
But I am the opposition.
Well, yeah, but you're the nice opposition.
Well, so for you to say that, generally speaking, the opposition has taken on that, to me, would be absolutely untrue. I am in the Senate. I was elected by the people of the state. I oppose what has been put forth. I've tried not just to oppose it, but actually lay out some ideas that I think will work. I think Lamar, to his credit, has been very much in the same tone, okay? And we all are working and talking constantly with people on the other side of the aisle to talk about what's right. We have bipartisan breakfasts. I've been to probably 50 or 60 meetings, Otis, in the last 2 or 3 months on health care. So I look at myself as an opponent. Are there people out there that are very concerned, legitimately very concerned? Yes. I mean, if you look at the expansion of government over the last 6 months, it's pretty large. And actually, it began even before. You look at the amount of indebtedness, it's large. People truly are concerned. Okay, so I think, look, let's go back to Iraq. I mean, there was some pretty vocal opposition to that. People, I don't know if you remember when President Bush would show up places, I mean, it was pretty brutal, and people were chaining themselves. So, look, you know, our country is a great country where opposition can be voiced. I hope that in these town hall meetings that they'll take on the tone of being able to listen to people, but I think it ends up, depending on the issue, I think, you know, people can be robust in their opposition. I think what you've seen in the Senate so far is a very civil discussion.
I just want to say, can I address that? I think people weren't concerned. People were terrified. Because what little leadership the president provided was, we have to get this done before we go on August recess. we're going to rush this through, we're going to cram it down your throats, and the only way people knew how to stop it was to be loud and to be in your face. I spent the weekend with 5 senior citizens. They're not concerned. My father-in-law's terrified. My father-in-law is not some ignorant country bumpkin. He has 2 college degrees. He worked 40 years. He does an at-home dialysis that on paper costs $23,000 a month, and he's terrified they're going to take that away from him. Terrified.
Yeah.
Not that they will leave him to die, but that they will say, well, you can't do this at-home dialysis anymore because it's too expensive. We're going to make you go home and spend 3 days a week at the center for 8 hours a day.
Yeah.
People are terrified, and that was the only way they knew to put the brakes on it.
But once the brakes did get on it, because the Congress left for the day, the rhetoric hasn't calmed down. The rhetoric has only gotten louder.
Yeah, but
so it hasn't worked out that way.
Well, I'd like to.
Why doesn't it calm down?
Well, you continue the tactic. I mean, if your goal is to stop it, then what they do.
It is a tactic.
But let me just address that. I think that both sides of the aisle. I think if you look at Gibbs and the president and the things they've said publicly, and you look at the Republicans, I think most people are looking at August as the defining moment in this healthcare debate. Okay, when people are out across the country talking. So, and I do think, in fairness, people are terrified. And I think again, when the president talks about having a private, unelected group deciding benefits. I think there's, and then they know the program's insolvent. I tell you, the group that I've said this enough publicly now, or I guess it doesn't matter anymore. I'm really shocked at AARP. I mean, to me, they've thrown their constituents under the bus, and I'm shocked. I'm shocked that there hasn't been a revolt by the many seniors that participate. Yes, sir.
Okay, Helen?
I was going to say that when President Clinton, when he first introduced health care, when the criticism that they did it primarily in secret and et cetera, and they wanted to just bring it to Congress and say, hey, here it is, and this is what we want without a lot of input from Congress. And seemingly this administration, the Obama administration, has come in and said they were going to not do that.
Right.
They were going to put it out there and then have a lot of input from Congress, but seemingly, that is not working. But I was listening to the president today, and you were talking about how the doctors would be affected. I was wondering, well, why he said that the AMA is on board, the Nurses Association, they all on board, and AARP, they all on board. And I was wondering, why would AMA be on board if this is going to be so detrimental to the doctors? I'm talking about pay, et cetera, et cetera, et cetera.
Yeah. Well, the AMA, this is my understanding, so I stand to be corrected, okay? But my understanding is the AMA represents a small percentage of physicians in our country, and that most of the members are academic physicians, okay? I know there's been numbers of physicians, thousands and thousands, that have dropped out of AMA after that endorsement. I know that, and I know that there are other groups that, or my understanding on this last part, that there are groups of physicians that are forming to actually counter what the AMA has done. But again, you get back to the AARP. How could they support taking $410 billion out of Medicare and not even dealing with the doc fix issue? That, to me, says a lot about the organization. And again, I may be going over the top in my criticism, and I'm sure that I'll see TV ads if I run again in response. But it's hard for me to believe that that could be, that they could deem that to be in their constituents' best interest.
Just to bring this back home, this morning you heard some of those advocacy groups outside the Rotary clubs asking you, you're going to visit 18 different cities, I think in 28 counties.
Right.
And they were wondering why one of those cities where you're having open forums wasn't Memphis, since we are the largest metropolitan area.
Yeah. And if you want the unvarnished answer, I think most people in public office have seen that there's just a lot better turnout, candidly, in counties that aren't urban areas at public meetings. I mean, if I just want to be so typically speaking, a public hearing in a county that's not an urban area is just of greater import, for lack of a better word. But I am here. I'm at the commercial appeal. They're watching this. We do tele town halls too, where we'll have thousands of people on the phone. Okay, and I guess what I would say is, how many senators in this country are going to be in 28 counties and have 18 town halls and go to Afghanistan and Pakistan during recess? That would be my response.
I'm sorry, you said that you have telephone?
We do telephone town halls too.
Would you be doing that for healthcare as well?
We just did one in Middle Tennessee, and we'll be doing more throughout the fall. So, and what happens, by the way, there are thousands of people on the call. Typically, it happens around dinner time, and people get in a queue and actually ask unvarnished, candid questions. And I'm sure we'll be doing it here. As a matter of fact, I'll tell you what I'll do. I'll commit to doing one in this area sometime in the next 5 weeks.
But in fairness, on Saturday, there was a town hall on health care in downtown Memphis, and the place was packed.
Yeah.
So it.
Yeah. Well, typically, it's hard for me to believe that you guys would criticize the fact that I'm having one in Fayette County and Tipton County. I mean, if somebody cares that much about health care, come on to Fayette County and Tipton County, and we'll have another public meeting here at some point. But I mean, it's what about the other? There's 95 counties, I guess. There could be criticisms by some. I'm, by the way, in all 95 counties often. Okay, I don't think you've seen a senator be more active in this regard, and I just think it's unfounded to criticize the fact that in the next county over, by the way, about half of those placard carriers were at the event, and who were complaining about it not being, were at the event in Tipton County, and I guarantee you they'll be tonight in Oakland. So there doesn't seem to be an access issue.
Well, we're happy you're here.
Thank you.
I'm working on a story about health insurance rates and news.
Now, let me say one other thing. Cohen does, by the way, represent Shelby County too, right? I mean, okay.
But he didn't have a problem getting an audit.
I understand.
Yeah, I'm working on a story about health insurance rates, and specifically about how, cuts to TennCare have really, some advocacy groups say, the number of uninsured people in Tennessee has skyrocketed as a result. The Med spent $112 million providing care for the uninsured last year.
Right.
And you talked about, the nation's budget indebtedness, and I'm wondering, how do you reconcile that with, all the money that the Med is now spending to treat these uninsured people? What's your position on TennCare also? Yeah, well,
TennCare is a state issue. It's really interesting actually that you bring it up. It was, the care is delivered by private carriers like Blue Cross. Okay, but if you go back to the issue I'm talking about, and that is, look, let's do something like an employer cap. Let's use those monies to actually create vouchers for people to buy health insurance. You'd have far less uncompensated care. So the more people that we can get in this country that actually carry private insurance, the less the less uncompensated care takes place. So it seems to me that, again, there is a lot of bipartisan support around that idea of people having insurance and doing it through the private sector, not through a government option, and it goes hand in hand to solving the kind of problems that the Met has.
I think we got time for a couple more questions.
But another piece would be Mississippi and Arkansas, for what it's worth, actually paying for their Medicaid patients to be at Med, and this year one of the toughest things that we've had to get done in the Senate, Lamar and I on the Senate side and Cohen on the House side, was even making it legal, believe it or not, legal under federal law for Medicaid patients in Mississippi and Arkansas to be able to pay at the Med. Now the issue is actually getting the General Assemblies to do the right thing, and so here we have this great trauma facility here that is basically keeping those states from building a trauma center, okay, and yet we can't get them to actually reimburse. That is a wrong that needs to be corrected. But again, we worked hard to make it legal because there's actually a score to the federal government. It costs the federal government money because the federal government pays 2/3 of the Medicaid cost. And so if they actually did pay for them, it would actually, it would create, some spending on the government side, federal government side.
I was just going to maybe just change the subject real quickly. In the paper, there have been a number of articles about the Cash for Clunkers program and how popular it is. And I know you think you supported reauthorizing the program. But I think originally you said some things critical of the program and had some very legitimate concerns about whether indeed it was really stimulating the economy or was it just helping out car dealerships. Did you originally change your thinking on that? I mean, obviously you approved the renewal, but were against the program initially.
Well, if you remember, the program was added on in a non-judicious way. It wasn't passed by the House or the Senate. It's passed as part of the legislation that went through the body, and then in conference it was airdropped in. Now, that I'm going to tell you, you're talking about an abuse of the legislative process and an abuse of the American people. That was it. That's called airdropping something in conference, something that, by the way, the President and most people who ran for public office said they would never allow it. So I was very critical, okay? And I think it also, I'm not sure, I don't think it was paid for. Okay, in other words, the program spent $1 billion and there was no pay for it. It wasn't taken out of another program, okay? So let's move it aside. The program passes. It actually looks like that it's stimulating sales to me, okay? So it comes back around, and we have $787 billion stimulus package, right? Only 16% of the money is out the door, okay? In other words, the money's not being spent at a time when we have a recession. Much of it, as you know, you've read it, is going to be spent over the next 3 or 4 years, which is kind of ludicrous for a stimulus program, okay? It was really, in many ways, just a massive spending program. So the vote that we made was on taking $2 billion out of the stimulus. In other words, it's already spent. It means it's paid for now, and putting it in the hands of the American people today. So yes, I thought that was a wiser deal. Today is when we have the economic problem. Today is when we're concerned about the double digits. Do I think the program's perfect? No. Does it bother me that we're, encouraging people to buy consumer goods? I know they're durable consumer goods, a little bit, but is it something that to me is a whole lot better? It's putting people in money, and I actually see that Chrysler and GM and Ford are looking at their shifts now and looking at bringing people on. Yes, I actually argued, for what it's worth, in favor of it in our caucus, because if you saw our caucus, most Republicans also in that same vote voted for the $15,000 housing tax credit. Almost no Democrats voted for that, but then almost no Republicans voted for the other. I thought, look, they look kind of similar to me, I'm sorry, and I voted for both. And do I think it's perfect? No. Is it pulling demand forward that may take place down the road? Yes, but it looks like to me it's a much better thing than leaving it on the back end of a stimulus plan that may take place in 2 or 3 or 4 years. So I voted for it. And in the Senate, I mean, one of the tough things about being in the Senate, you never get a pure shot at doing something exactly the way you think it ought to be done. So to me, it looks like it's far more stimulative than leaving it to a bureaucrat to decide on future spending on something else. So I support it. So, and by the way, I think it's actually showing signs of being stimulative. I mean, we've seen some results, by the way, since the first one passed.
It's created some jobs and circulated some money. If they didn't do anything else. Listen.
You haven't addressed medical malpractice, the issue of that, and how that comes into health care.
Yeah, I've written op-eds when people have asked and stated the fact that tort reform is certainly an issue that we need to fix and correct. There's no doubt there's a lot of tests that are ordered because of defensive medicine. California's passed a law. It's had a big effect on tort issues. Texas has passed a law. It's had a big effect. So I do think we need to address it. I'm also a pragmatist. and will tell you that based on the makeup of the Senate and the House today, it's likely, it's very unlikely that that's going to occur. Okay, there's a large constituency for trial lawyers in the House and Senate today, and it's very unlikely that at the federal level something like that's going to occur. So again, do I think it's a good thing? Yes. When I write op-eds and have enough words to do it, do I address it? Yes. But I guess what I'm really trying to do is figure out those things in the middle that are centrist issues that I think we can actually make happen this year that go a long way towards solving the problem.
Any other questions? One last question from me, Senator. When you and I talked a couple of weeks ago concerning your vote for Supreme Court nominee, you said at that time that you were being intentionally being a little bit general about your opposition,
yeah,
so that later on down the road you didn't want to be pigeonholed on.
That's right.
Now, is that where are you going to position yourself for future Supreme Court nominees?
Well, you know, I told the citizens of this state two things about Supreme Court nominees when I ran. Number one, that unless there's some extreme, unusual situation, I think when a president nominates a justice, there ought to be a vote. That you shouldn't filibuster. That the president, when somebody's elected, it's the consequences of what the people have said, and that there ought to be a vote, unless, again, there's something really extreme. Number two, that my judgment of a justice would be based on whether I saw them as someone who was a constructionist, or whether they saw themselves as someone who was shaping laws based on their personal views. And I spent a good deal of time talking with the now justice. She is certainly an impressive person and well educated, and I told you also it was a painful call. I called 4 Hispanic leaders in this state who to them and to many others, she is an absolute role model, to tell them that I was going to vote against her. But it was based on the fact that I truly believe that she views the Supreme Court as a place where wrongs are righted, not a place where you apply law to a specific case. And to me, that's not appropriate, whether it's being done by somebody on the right or the left. And the reason I didn't want to cite cases, which is what some people did, I mean, they went through a litany of cases. We may have a justice that comes up that disagrees with me strongly on a case I might have cited her own. But I might really get the feeling that they view the Supreme Court the way I do, and that is that it's a body where you apply law to specific cases, and to the extent that they can, to use overused language that we've heard many times over the last couple of months, they view themselves as an umpire, okay? And they may have a difference of opinion on me on certain things that they may have said when they were in private practice or something else. So I just didn't want to be, I adhered to the two things that I told the people of this state. You know, was it painful to talk to the leaders? Yes. Do I believe that I made the right decision based on what I know at the time? Absolutely I do. Do we know the outcome of these things? There have been a lot of surprises on the Supreme Court, both ways, okay? And I don't think it's possible to call them 100% right, but you call it based on what you feel at the time, based on the information you've had, and that was a call I made.
Okay, fair enough. All right.
Let me ask you this while the streamer's on. Did I misstate anything earlier? So I just want to make sure while my team is here, so I can publicly, if I said...
We'll straighten you out tomorrow.
As a major man up, I think Matt Villian has been nominated for the appellate court.
Right.
Have you made up your mind on that person?
I called her to congratulate her, and I know she's been by to meet Todd in the office. I have not met her yet. I know of her family, but, you know, until I meet her,
that's the doctorate position.
It is,
yeah.
And anyway, I've heard some good things professionally about her, and I look forward to meeting her.
Yeah. All right. Thank you very much, Senator.
Thank you, Lindsay.
Later today.
Appreciate it. Thank you.
Thank you.
Thank you. Appreciate it. Tell your dad not to be too afraid. I think it's going to work out okay. Thank you.
My father-in-law, he was. I was really actually startling.
Thank you.
Thanks, Senator. Appreciate it. Thanks for coming. See you again soon.